Hello and welcome. Today we're diving into a rare and fascinating condition, bladder pheochromocytoma. This tumor, while uncommon, can have significant impacts on a person's health, so let's explore what it is, how it develops, and what can be done about it. The exact cause of bladder pheochromocytoma, like many tumors, isn't always clear. However, it stems from the chromaffin cells located in the wall of the bladder. These cells are similar to those found in the adrenal glands, and they're responsible for producing catecholamines, hormones like adrenaline and noradrenaline. Genetic mutations, especially those associated with conditions like multiple endocrine neoplasia type 2 Mentel, von Hippel-Lindau disease HL, and neurofibromatosis type 1 NF1, can increase the risk of developing this tumor. However, in many cases the occurrence is sporadic, meaning it happens without a known genetic predisposition. Now let's delve into the pathophysiology. Bladder pheochromocytomas function much like their adrenal counterparts. They autonomously secrete excessive amounts of catecholamines. These hormones trigger a cascade of effects in the body. They bind to receptors in various organs, causing a surge in blood pressure, increased heart rate, and heightened anxiety. The location of the tumor within the bladder means that catecholamine release can be particularly pronounced during urination, when the bladder wall contracts, squeezing the tumor and stimulating hormone release. This intermittent release pattern contributes to the characteristic paroxysmal symptoms associated with the condition. Bladder pheochromocytoma is a rare entity. Compared to pheochromocytomas arising in the adrenal glands, bladder cases represent a very small percentage. It affects men and women relatively equally, and while it can occur at any age, it is most frequently diagnosed in middle-aged adults. Due to its rarity, precise epidemiological data is limited, and many cases may go undiagnosed or misdiagnosed initially, highlighting the need for increased awareness among healthcare professionals. The signs and symptoms of bladder pheochromocytoma can be quite dramatic and often intermittent. The most common symptom is paroxysmal hypertension, meaning sudden and severe spikes in blood pressure, often associated with urination. This can be accompanied by a pounding headache, palpitations, excessive sweating, anxiety, and tremor. Patients may also experience pain or discomfort in the lower abdomen or flank, and some may notice blood in their urine hematuria. Because these symptoms can mimic other conditions, such as panic attacks or benign prostatic hyperplasia, a high index of suspicion is crucial for accurate diagnosis. Diagnosing bladder pheochromocytoma requires a multifaceted approach. Initially, suspicion is raised by the characteristic symptoms. Biochemical testing is essential to confirm the overproduction of catecholamines. This involves measuring levels of metanephrines and catecholamines in both urine and blood. Once biochemical confirmation is achieved, imaging studies are necessary to locate the tumor. CT scans and MRI are commonly used, providing detailed images of the bladder and surrounding tissues. Finally, cystoscopy, a procedure involving inserting a thin, flexible tube with a camera into the bladder, allows for direct visualization of the tumor, and a biopsy can be taken for pathological confirmation. Generally, bladder pheochromocytomas are not classified into different types in the same way as other cancers are. The primary classification relates to whether the tumor is benign or malignant. Malignant bladder pheochromocytomas are very rare. Genetic testing may also be considered to determine if the tumor is associated with an underlying genetic syndrome. The tumor size and location can also be important factors in determining the best course of treatment. The primary treatment for bladder pheochromocytoma is surgical removal of the tumor. This is typically achieved through a partial cystectomy, where only the portion of the bladder containing the tumor is removed, preserving as much of the bladder's function as possible. Prior to surgery, patients are usually treated with alpha blockers to control their blood pressure and prevent hypertensive crises during the procedure. In rare cases where the tumor is malignant or has spread beyond the bladder, additional treatments such as radiation therapy or chemotherapy may be considered. Lifelong follow-up is essential to monitor for recurrence or the development of new tumors. Currently, there are no specific preventive measures for bladder pheochromocytoma, especially since many cases are sporadic. However, individuals with known genetic predispositions, such as MEN2 VHL or F1, should undergo regular screening for pheochromocytomas, including those located in the bladder. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, may contribute to overall well-being, but there's no direct evidence to suggest it prevents the development of this specific tumor. The prognosis for bladder pheochromocytoma is generally good when the tumor is benign and completely removed surgically. However, long-term follow-up is essential to monitor for recurrence or the development of malignancy. Recent research is focused on identifying novel genetic mutations associated with pheochromocytomas and developing more targeted therapies. The use of advanced imaging techniques is also improving the accuracy of diagnosis and surgical planning. As our understanding of the underlying mechanisms of these tumors grows, we can expect to see further advancements in their treatment and management.